Hello, my name is Jonathan Parks. I am a student at Oakland University in the Department of Nursing. This presentation is for course NRS 4571, instructor Dr. Pali Drollard. Today's date is 4/21/2026. Article identification is the article I selected for assignment number 7, Chanelli A, Steiner L.M., Bonetti L., Levati S., Desmet M. 2024. This is a bachelor's degree for entering the nursing profession, a scoping review for supported informed healthcare policies. Internal Journal of Nursing Studies Advances 6/100171. This is a peer-reviewed scoping review that examines whether a bachelor's degree should be the entry-level requirement for nursing practice. The summary of authors' perspectives. The authors of my selected article argue that a Bachelor's of Science BSN should be the minimum entry-level requirement for nurses. Their review included multiple studies, position papers, and reports. Overall, the evidence consistently showed the higher proportions of BSN prepared nurses are associated with better patient outcomes. For example, lower patient mortality rates, reduced hospital readmissions, decreased failure to rescue incidents. Also emphasizes that increasing BSN prepared nurses improves quality of care, patient safety, and healthcare system efficiency. Additionally, the authors highlight that modern healthcare is becoming more complex. Nurses are expected to use critical thinking, evidence-based practice, and leadership skills, which are more strongly developed in BSN programs. Now comparing this to the assigned articles, the study by Lassater 2001 found that increasing the proportion of BSN prepared nurses in the hospitals were linked to lower mortality rates, fewer readmissions, and shorter hospital stays. Similarly, Porterat Dallerbruch 2022 found that hospitals with more BSN prepared nurses had lower 30-day surgical mortality rates. Finally, the Nurse.com blog BSN in 10 legislation in New York supports the idea that nurses should obtain a BSN within 10 years of entering the nursing practice to improve long-term patient outcomes and professional standards. Comparison of articles. All of the articles strongly support the idea that higher education in nursing leads to better patient outcomes. A key similarity is that all sources link BSN education to reduced mortality and improved patient safety. However, there are some differences. My selected article is a broad scoping review, incorporating many types of evidence, including policy statements and international perspectives. The Lassater 2021 and Porterat Dallerbruch 2022 studies are more quantitative and focus on specific patient outcomes, such as mortality and readmissions. The Nurse.com blog provides a policy and legislative perspective showing how research is being applied in real-world healthcare systems. Another difference is that my article also discusses economic and workforce impacts, noting that BSN prepared nurses can be more cost-effective due to improved outcomes and reduced complications. Personal opinion and evidence-based support. Based on the evidence, I believe that a Bachelor of Science BSN should be required as an entry-level degree for nursing practice. The strongest reason for this is patient safety. Multiple studies show that higher levels of BSN prepared nurses are associated with lower mortality and better outcomes. When patient lives are at stake, education levels should not be compromised. Additionally, healthcare today is highly complex. Nurses must interpret research, use critical thinking, collaborate with interdisciplinary teams, adapt to new technologies, BSN programs are designed to develop these skills more thoroughly than a diploma or associate degree program. Another important point is professional advancement. Requiring a BSN can strengthen the nursing profession, improve leadership opportunities, align nursing with other healthcare professions that require education of higher such. However, I also recognize potential challenges. Requiring a BSN may limit access for some students, increase financial burden, or contribute to short-term nursing shortages. This is why I support a balanced approach such as the BSN 10 model, where nurses can enter the practice early but must complete BSN within a set time frame. Overall, the evidence clearly shows that a more highly educated nursing workforce leads to better patient outcomes, stronger healthcare systems, and improved professional standards. My closing statement: in conclusion, the research strongly supports making the BSN the standard for entry into nursing practice. While challenges exist, they can be addressed through supportive policies and educational pathways. Thank you for taking the time to listen to my presentation.